Wonderful, thank you. And we are recording now. Today's meeting is a public hearing for our annual update on our Mental Health Services Act 3-year plan from the Lake County Behavioral Health Department. And we have most of the Mental Health Advisory Board here on today, as well as our peer centers. I just wanted to give a brief introduction to our Mental Health Advisory Board with a quick note that our main purpose of the board, and we meet every month on the third Thursday of the month from 3 to 5. And anybody who wants an invite to that can email me or note for me in chat, and I will add your email address to our distribution list. I will ask if everyone could please use chat to introduce themselves, unless you're in one of the peer centers, in which case I'll let you introduce yourselves through the sign-in list that you have at each location. So the Mental Health Advisory Board's main purpose is to review and evaluate the community's public mental health needs, services, facilities, and special problems in any facility within the county or jurisdiction where mental health evaluations or services are being provided, including but not limited to schools, emergency departments, and psychiatric facilities. So that is the purpose of our board. And one of the things we're really focused on is trying to increase the amount of public input we have. That is the participation of consumers of mental health services, family members of consumers, and providers of public health services as well. Thank you, Jorge. We have them unmuted there for a second. And so we just want to try to increase as much public participation in all of the mental health and behavioral health services that are available in Lake County, and identify where the needs are and where we can improve services, and make suggestions that'll change legislature and policy, procedures, and the services themselves to help reach more people and help increase the mental health, the overall mental health and behavioral health of our population. So I will thank you all so much for being here. I greatly appreciate your participation. And with that, I will pass it over to Scott Abbott.
Hi, good morning, everyone. My name is Scott Abbott. I am the Mental Health Services Act Program Manager. Also do housing at the same time. And I want to welcome everyone here for our public hearing. This is we do these once a year for our updates or for our 3-year plans, depending on where we're at in the process. And just really want to thank all of you for taking time out of your day to be here. Just want to recognize, and I'll do this a few times today, just want to recognize the importance of you being here and the gratitude that we feel for you being here to provide us feedback and to listen to what we have to say. I just want to mention that we have 3 really significant firsts happening at this particular meeting. This is the first time in quite some time that we've had our Mental Health Advisory Board hosting this meeting. So that's super exciting. I'm just really glad to have Julie be able to introduce this and host this, because this is exactly what we're supposed to be doing. And so this is a great thing to celebrate. Another thing that we're doing first is this is our first hybrid meeting, where we're having it both via Zoom, and it's also taking place at our peer support centers around the county. This is something I've always envisioned, even long before the pandemic, to be able to have a meeting like this, where previously we've had these meetings at our peer support centers before the pandemic, and they were good. We had lots of attendance, especially when we provided lunch, and they were really significant. and we got a lot of people, but there was just a lot of people that couldn't make it because of scheduling or transportation or whatever. So I always wanted to have, you know, the ability to be able to have it in everyone's homes. And lo and behold, the pandemic came along and really helped out with that. And so now we have that ability to do it. And we've been doing Zoom meetings. I'm sure we've all been doing Zoom meetings, but for this past year with MHSA, this is the first time we've really been able to add the peer support centers as their own entity, because one, they're open now, and two, they have smart boards and the technology within them to be able to do this. So the hope is to continue this kind of format from here on out. So you have both the opportunity to attend in person or attend virtually, whichever is the most convenient for you. And the third thing I'm really excited about, which is the first, is we have materials, including this PowerPoint we have here, in Spanish. This is something that we haven't had previously. I don't know why we haven't had previously, but we do now. And so I'm very proud and excited about that. And I want to thank RDA again for doing that. It's a great thing to have, to be able to make sure that, you know, that this presentation is available for the entire county. So with that, I want to turn the time back over to Jamie, and she will be doing our presentation. I'll be poking in occasionally. Thanks.
Great, thank you so much, and thank you for the warm welcome and introduction for both Julie and Scott. My name is Jamie Dorsey, and I'm also here with my colleague, Stephanie Beamar. We're both from RDA Consulting. We might look familiar to some of you. We've been helping to facilitate this annual update process over this last year. So I've been facilitating the community meetings, as well as helping support Lake County to put together the annual update. So we'll be walking through some of the information from that annual update, some of the key highlights. So if you haven't already, I think there were some folks who just joined. If you're joining virtually, it would be great if you could just introduce yourself in the chat, just with your name, pronouns, program, and any other information you'd like to provide about who is here. If you're joining in person, again, we have the sign-in sheets that we'd love for you to fill out so we know who's participating with us today. For today's agenda, so we're going to start with some MHSA training and education. So we'll give an overview of the MHSA background, as well as the annual update and community planning process. Then we'll move into sharing the key findings from the needs assessment that we conducted. Then we'll move into talking about the proposed MHSA program modifications for this upcoming year, fiscal year 21-22, as well as the associated budget request for MHSA programs for this upcoming year. And then we'll open it up to public comment, and that's the opportunity for everybody here to share any of your feedback, comments, and questions. And as Scott and Julie both said, the meeting objectives are really to present the proposed MHSA annual update for the upcoming year, as well as provide the opportunity for all of you to provide your input. So just some meeting tips. So as Scott mentioned, this is our first hybrid meeting. So for the folks who are attending at each of the peer support centers, so you're probably already aware of this, but there will be a coordinator at each site to help manage the Zoom meeting and facilitate attendee participation. If you're joining virtually, try and find a quiet, distraction-free location. If possible, close any other applications that'll help improve the performance. We're asking folks, so this has a different feel than the community meetings that are more kind of discussion based. We're asking folks to save any substantive comments, questions, or feedback for this public comment portion at the end of the meeting. Of course, if you have any clarifying questions throughout the presentation, feel free to ask those. And you can do that by raising your hand, entering a question into the chat. We'll be monitoring that. And again, if you are attending in person, you can raise your hand and let the on-site coordinator know that you have a question, and they'll either raise their hand on your behalf or they'll enter your question into the chat. So moving into the Mental Health Services Act training and education component. So MHSA is also known as Proposition 63, and this was passed on November 2nd, 2004. MHSA is also known as the millionaire's tax, and it's a 1% tax on individuals who have an income of over $1 million. And the purpose of the MHSA is really to expand and transform mental health services. It's designed to go to counties to help enhance their mental health services to really meet the community's needs in each location. The MHSA has 5 guiding principles or core values, and they are that services focus on promoting wellness, recovery, and resilience, that services are culturally competent and responsive, that services are client and family driven, that services are integrated and coordinated, and lastly, that there's community collaboration among stakeholders to help plan services and fulfill the shared vision and goal for the mental health services in each location. There are also 5 key components of MHSA. So the largest, or each of the different types of services and programming fall into. The first is community services and supports. So this is the largest group of mental health services. So these are the services that are really designed to provide direct treatment and direct services to individuals with identified mental health needs. So this can include this, and half of the community services and supports funding needs to go to full service partnerships. And those programs are the ones that are intensive community-based services that are providing wraparound services. In addition to full service partnerships, this might be direct clinical services, crisis services, outreach and engagement services. The next component is prevention and early intervention, and this is about 20% of MHSA funding needs to go to these types of services. And these services are really designed to prevent the development of mental health problems before the onset, with the exception of services that can also be provided to intervene with early onset of psychosis. And these are also a lot of screening services and to intervene with early warning signs. There's also the innovation services, and these can be, innovation programs can receive up to 5% of funding from communities, services and supports, and prevention and early intervention. And innovation programs are really designed to allow counties to try something new, to try out different approaches or something new in their community, and to see what works, and to just try different approaches to better serving the community and get a little bit creative. And this year, we actually, Lake County does have a new innovation program. So Scott will talk a little bit about that once we talk about program modifications. The remaining 2, workforce education and training, as well as capital facilities and technology needs. So workforce education and training, this is funding that can be dedicated to helping to build, retain, and train the public mental health workforce. And then capital facilities and technology needs, this is really the infrastructure support to help improve service delivery. So this can be technological needs like electronic health records, as well as mental health facilities or things like generators. And there's no required funding for each of these, but MHSA or counties can allocate up to 20% of MHSA funding to these different components. And this is just a snapshot of the existing MHSA programs as of fiscal year 2021. So in the community services and supports, some of the key programs in CSS, like I said, the full service partnerships, also older adult access, parent partner support, the forensic mental health partnership, crisis access continuum, and the trauma focused co-occurring disorder screening and treatment. The prevention and early intervention, these are the early intervention services, family stabilization and well-being, or the NEST. The older adult outreach and prevention services. Each of the peer support recovery centers actually get blended funding from CSS and PEI. The postpartum depression screening, or Motherwise. The prevention mini grants, and then statewide, regional, and local projects. The innovation program that will actually be ending this year is the full cycle referral and consumer driven care coordination. And then for capital facilities and technologies, again, this is money that's going towards electronic health records or any capital facilities improvement. And then there's also funding for the workforce education and training. If you'd like to learn more about any of the MHSA programs, you can go to Lake County's MHSA website. And there's information here about each of the programs, what the programs are. There's also the progress updates if you want to learn more about each program's individual updates for this year, as well as outcomes. And this is also where all of the MHSA resources are posted.
I just want to maybe add something real quick in there about that. Our website has really gone through a transformation recently, last few months, thanks to Patty Russell, who's our analyst, and she has really spent a lot of time and effort really upgrading our website to include information about each of our programs, and also some data that comes from each of our programs, like numbers attended and some outcomes and some some things that we haven't been able to really share before, but now we got a good chance to do that.
Thanks, Scott, and thank you, Patty, for all of your work. And I dropped the link into the chat if anyone wants to peruse that website. So moving into just an overview of the annual update and community planning process. So this was already mentioned, but the annual update, so last year we did the 3-year planning process to plan services for fiscal year 2020 through 2023. And the annual update is to provide updates to that adopted 3-year plan. So this will, in the annual update, includes program status updates as well as service accomplishments for the previous fiscal year, so fiscal year 1920. And then also to share program changes beginning in fiscal year 21-22 based on the needs assessment and stakeholder input. As mentioned, one of the core values of MHSA is community collaboration. So MHSA intends that there be a meaningful stakeholder process to provide subject matter expertise to the development of the plans, but then also really make sure that the MHSA programming is aligning with each community's needs and is being used appropriately at the local level. There are a variety of stakeholders that are intended to be involved in the community planning process. And this is really kind of any stakeholder group who touches the mental health system. So this includes consumers and family members of mental health services, providers of mental health services, first responder agencies, education services, social services, veterans, substance use services, healthcare organizations, or any other group that has an invested interest or intersection with mental health services. For roles and responsibilities, Julie actually gave a really great overview of a lot of this, but for all of you, the stakeholders, you're all here because we need to hear your perspective and understand the needs of the community, and as well as identify strategies to meet those community needs. The Behavioral Health Services Department is responsible for implementing the MHSA programming, and as well as developing the program update that is reflective of those community needs that were identified through the planning process. The Behavioral Health Board, Julie gave more detail about the overall role of the Behavioral Health Board, but specifically to the annual update, it's to assure that there is the right stakeholder involvement, to review and advise on the annual update, and then post the public hearing. The Board of Supervisors will also be reviewing and approving the annual update. And then we from RDA, we're just helping to facilitate this process. We're collecting the findings, synthesizing everything that we've heard from all of the stakeholders, facilitating those discussions, and helping to compile all of this information into the annual update. A quick timeline. So we started this process back in December 2020. We had a kickoff meeting, as well as did some review and developed materials for the annual update. Then we started the needs assessment process in January. At that time, we had a community meeting to understand what the community's needs are, especially with COVID and how things changed throughout the pandemic. We also had a community survey. And then we were also collecting data from each of the programs about their numbers served, as well as their updates and what they'll be doing in the future. Then we moved into the program planning phase, where we synthesized all of the input that we heard from the community meeting and the community surveys. And we had another community meeting to vet those findings, get any additional nuance or context around those findings, and start to identify strategies that Lake could implement to meet those needs. Then beginning in May, we synthesized all of that information and developed the annual update. The plan was posted publicly on June 22nd. And then today, and it was posted for 30 days. And then today is that public hearing to get any last public comment or public feedback. Next steps after this will be to incorporate all of the public comment that we hear, finalize the plan, and then that will be presented to the Board of Supervisors in August. And so this concludes the MHSA training components. You all have been trained on MHSA.
We have to say that by regulation.
Thank you, Scott. And now we will move into the community needs assessment findings. So as I mentioned, we had 2 community meetings, one in February and one in April. And during both of those meetings, we had a total of 104 participants. We also had a community survey that was open from January through March, and there were 17 folks who participated in that. This figure shows the stakeholder affiliation of folks who participated. So about 1/3 of folks were other service providers and community stakeholders, and we had really wide representation. We had legal and justice agencies, social services, education services, housing providers, law enforcement, first responders, consumer advocates, and other interested stakeholders. 1/4 were behavioral health service providers, including Lake County staff, contracted service providers, as well as other behavioral health service providers in the community. 7% were consumers and family members. And about 1/3 of folks did not, their stakeholder affiliation was unreported. So just another plug that we get this information through the demographic survey. So we really encourage folks to take that, because that actually allows us to understand who is participating in this process. So moving into some of the things that we heard. So some of the strengths that we heard were that telehealth and virtual services really enabled people to continue engaging in services throughout the pandemic, and that was really useful for some populations. We also heard that Lake County was really leveraging social media in order to share information. We heard a lot about using more Facebook and different avenues to kind of share information without being able to necessarily receive services in person. We also heard just overall that people felt like there was greater compassion and understanding of mental health challenges, as so many people were experiencing mental health challenges throughout the pandemic. Some of the challenges on the flip side of telehealth and virtual services, while those did help some people continue to engage, we also heard that those weren't accessible or appropriate for everybody. Some people lack the necessary technology to engage in virtual services, including providers and consumers themselves. In other cases, maybe the internet connection was unreliable. Some people may not have had the digital literacy necessary to participate. And for some people, they just prefer not to participate virtually, and they really like the in-person interaction. We also heard that outreach was just more challenging throughout the pandemic with social distancing and in-person service restrictions. As far as community needs, some of the populations that we heard that were experiencing increased needs, we heard pretty widely across the board that teens were really experiencing increased needs throughout the pandemic. We also heard older adults, folks that are chronically homeless, parents of young children and teens. We heard that in Clear Lake and South County, where there are more limited services. And we also heard other stakeholder groups, including the Hispanic and Latinx population, tribal communities, LGBTQ+ populations, that really everybody was experiencing increased needs, but really focusing on the teens. We heard from folks that there was an increased need and demand for services overall, that there were increases in anxiety and stress and mood disorders, that there were increases in substance use, and the need for those services, that there was more suicidal ideation, again, particularly among these teen groups, but also the needs were just becoming more complex with the financial stress, relational stress, and other social stressors related to the pandemic. It wasn't just mental health needs, it was all of these things kind of combined, where there were more complex needs that people were seeking support for. We also heard that there was really the need for increased options for service delivery, that there needed to be more, in particular, we heard over and over that there needed to be more field-based services, as well as in-home services, and then also maybe opportunities to provide loans for different technology or equipment to make sure that people could participate in services. We also heard the need for more outreach and prevention services, particularly those with mild to moderate needs. We also heard that transportation assistance and support was going to be a need as services start to open back up again, particularly for those folks who don't want to or had trouble engaging in virtual services. There was the need for more community health workers and peer support counselors in order to extend the workforce and provide some of more of these in-home and field-based services. We also heard the need for more internal collaboration between Lake County and the contract providers in order to kind of share more lessons learned and just have more opportunities to kind of share about services. We also heard about the need for more coordination between Lake County and external agencies, particularly as people's needs were becoming more complex. That there's all of these other financial, social, relational stressors, that there should be more coordination among county agencies overall. We also heard that there should be better integration of disaster and emergency preparedness plans into mental health service delivery, as well as other service delivery. And then also just the improved collection, use, and sharing of data to inform decision-making. So some of the strategies that we heard from everybody was to provide more technology to those in need through these tech loans or identifying grants or different opportunities to be able to provide that technology. To also leverage partnerships and community resources to develop home visiting programs. We heard about partnering with some agencies such as Adventist Health, who are already providing these services or looking to provide these services, and see where there are opportunities for collaboration. The need to expand outreach and prevention services and really get to those folks who aren't necessarily coming in for services or are more in outlying areas of the counties. We also heard the need, the opportunity to promote and strengthen 211 services and other resource directories, making sure that those are up to date, identifying different funding streams that could be used to strengthen those services, and then also seeing if there are ways to make these accessible to folks who maybe don't have the digital literacy and not just going onto a website, but finding different strategies to make sure that people are really aware of the services out there. We also heard about conducting regular meetings with Lake County Behavioral Services and contract providers, just to make sure there's more of that consistent communication and opportunities to share and learn from one another, as well as partnering with external agencies to provide and coordinate services. So seeing what else is in the community and really leveraging those partnerships. We heard about creating virtual or hybrid services, as well as training options for different programs, particularly for programs that maybe had to stop services or stop training. So for example, with mental health first aid, looking at different hybrid training models that allow both virtual and in-person participation. We heard about creating older adult support networks, so things like phone trees or leveraging existing services, Meals on Wheels, other things to just try and engage the older adult population, as well as providing more parenting resources and support. Finding ways to bolster youth mental health services, again, leveraging existing grant opportunities or services that are there, providing more services in the schools, and finding ways to really strengthen the services in the county. Creating more training opportunities for community health workers and peer support counselors in order to extend that population and have more of a grow your own approach. And then providing incentives to recruit and retain the workforce that is in Lake County. So with this, I will turn it over to Scott to talk through the MHSA program modifications for this upcoming fiscal year that address some of these needs.
Okay, can we go to the next slide?
Yep.
So again, here's the similar slide we had earlier that has a listing of our programs underneath the the major headings of CSS, PEI, and innovation, and etc. Same listing, except you'll notice a few in bold that are new. And I guess before I jump into those, I think just want to just speak briefly about the challenges of this past year that all these programs, I'm sure all of your programs and lives have experienced through the pandemic, and the pandemic creating additional barriers and complications, and also particularly additional mental health needs that are needing to be addressed. And so I think a big part of what we're doing, I'm sure what you're doing, is we'll be spending a good portion of our time and our efforts of addressing those type of needs. There's definitely been mental health impacts from the stay-at-home orders, for example, and the isolation that's resulted from that. We talked about particularly our youth have felt that, and there is significant worries how our youth are coping with the results of the pandemic. And so all of our programs in some fashion or another will be addressing that within this coming year. You can go to the next slide and we'll speak specifically about some of the changes. So new programs and modifications. So these next, well, two of these three new programs are actually just kind of outgrowths from our normal prevention and outreach that we've had. We thought what we would do is just really kind of, I don't know, like call them out or separate them out or kind of pull them out, whatever you want to call it, because we need to measure them better for our reporting. And so we thought if we just kind of set them aside as their own program, we'll be able to capture some of the measurements that we need to do. We were doing these programs in some regard already, but they will be definitely upgraded and bolstered. Our street outreach program, new mobile street outreach, which we'll be doing. We've talked previously that we are obtaining outreach and prevention workers, 5 in all. We have 2 of those on board, and we will be hiring an additional one. Each one will be kind of, they'll act as a team of outreach and prevention workers, but they'll also be associated with our peer support centers, and one will be associated with the senior centers because they'll be addressing that population. Mobile, in that we have county cars that will be going out, but also we've attained this past year an outreach van that we'll be using to go out. And as mentioned, we have obtained that. We're going through the process of customizing it to be an outreach van. We're going to be adding some shelving and storage type of utilities within the van to hold things we'll be passing out to people that we come in contact with, including things like cell phones, to kind of address what we talked about earlier about helping people obtain some of that technology to be able to have more supports virtually. So that's an exciting endeavor that we'll be doing this year. It'll be really interesting to see how that shapes up. Mental health first aid, we've been doing for quite a while. And we'll just be doing continued more of it. The pandemic put some complications in that. We're started to do some mental health first aid virtually, but you know, we've also will be doing it in person, going out to different places to do it. Also, we'll be doing a lot of it at Lavos as we move Lavos to a new location in Clear Lake, and has additional room where we can do presentations such as our mental health first aid. So that will just be increasing. Our multi-county FSP Innovation Collaborative. If you've been to these meetings previously, you've heard me talk a little bit about that. This is something that's pretty exciting. It's a multi-county collaborative trying to improve our full service partnership programs across the state, using data, very specifically data to better our programs. This is really exciting. We are just getting our data system to work properly for this, and the multi-county collaborative, I think, will just do better. The collaborative will also be informing the state of what they can do better to help in this process. And so it's going to be, you know, quite exciting. It's existed for a number of years. They're just kind of opening up now to small rural counties, and so we're joining within hopefully a pretty short period of time. So it's something that should really impact us. It should impact our clients. Our full service partnership programs is our biggest mental health services program, where a good portion of our funding goes to. And so anything that we can do to improve that, I think, is a really good thing for the plan. Other notable progress, you know, kind of tied along with this, before I kind of jump into it, you know, one thing that, you know, I mentioned the things that we're doing new for the first time this year at the beginning of our presentation. Another thing that's new is we're getting some support from some other grants, which will be supporting MHSA programs. I mentioned our outreach van. We were able to purchase that outreach van through the cannabis grant that the county receives. You see the second one there, early intervention services received, which we received. It's called an early psychosis intervention grant. It's a $2 million grant, which will support our early intervention services in our PEI program. So we're going to really be able to expand that, and that will really be able, you know, as you can imagine, be directed toward youth and young people, K age, particularly some of the people that are significantly have been impacted by the pandemic, which I mentioned earlier. So this is a great thing, and we're just getting that grant kicked off and getting that going. There's a lot of training that goes with that particular grant, and our staff has been doing it all through this month of July. So there's just you know, some really great opportunities that present itself in that. Another grant that we received, which kind of surprised us because originally we were turned down by this grant that we applied for last year, is a grant that's called the Mental Health Student Services Act grant. And it was a grant to help identify youth in the schools that need some support, some mental health support, some services, some treatment interventions. And as you can imagine, that's something that's even more important as we're coming out of the pandemic and students are returning to school. And that's why the state reevaluated our grant application last year and decided to give it to us this year because they recognized that need. This will be done in partnership with the Lake County Office of Education. It's also a $2 million grant over 4 years, and it will definitely be good for the youth in our county. And that's also just at the beginning phases. The state really wants to get that going as quickly as possible. And so we're hoping to get that really rolling out by the time school is starting this fall. A couple other additional things right there just to mention. We have hired a wet coordinator who's will be kind of really monitoring and coordinating those efforts for our workforce education and training. Particularly important within that is the just emerging Superior Region collaborative with other counties that we're doing, where we're going to have loan repayment, stipends, and scholarships available to our workforce to increase their training. We'll also have some local monies, which will also assist with that as well, particularly for people that are really considering going into our field. So we're hopefully, between those efforts, we'll really be able to train staff and retain staff and recruit staff, it's really important. Having a solid workforce, as you can imagine, is really paramount for what we need to be able to do. And finally, I mentioned our new innovation collaborative, but our current innovation project is now just changing over toward being funded by our whole person care grant. That project will continue. It will still report to the innovations committee that we have about what's happening with it, but it will be funded by the whole person care grant. I think I've blathered enough, right? Yes, Jamie nods yes. Okay. You want me to cover this part, Jamie?
Sure. This is just a quick recap. At the beginning, we mentioned each of the different components and the funding associated with them. So just as a reminder, the community services and supports of the CSS gets the bulk of the funding, about 75%, and half of that has to go to FSP programs. And then about 20% goes to the prevention and early intervention, and then up to 5% can go to the innovation projects coming out of the PEI and CSS. So just wanted to give that recap before I turn it back over to Scott to actually talk through the budget request.
This is just a kind of a summary of our budget request, what each component, what we've budgeted for. We've usually budget pretty conservatively. You've heard me talk in the past year about the impacts of the pandemic on the state budget and on MHSA. And when the pandemic first started, over a year ago now, there was a pretty big, or at least a mild panic about funding and what the funding was going to look like. MHSA was projected to have about somewhere between a 20 and 30% drop in revenue that we would have. However, as you probably, if you watched the news recently, California is not tail spinning down budget wise. In fact, they had a great surplus of funds. And so we're not anticipating that MHSA's funding will be impacted as what we did before, but we still budget conservatively. We also traditionally don't spend as much as we budget, and we carry that on to the following years. And so as a result, we have some funding that we can be able to do the things that we plan to do. And this is our current budget. I still probably will, be proposing that we keep it to pretty much the same for the next few years, because that's kind of where we've been at. Okay.
So now we are going to move into the public comment and discussion period. So this is everybody's opportunity to kind of share any questions, thoughts, feedback. So this feels maybe a little different, a little bit more formal than other community meetings, but I just wanted to note that there is a 3-minute time limit on comments. So for spoken comments, we'll be keeping a timer separately, and we'll give you a warning when you're at 1 minute. But there are different ways to contribute to the discussion. So if you would like to speak through the computer, you can just raise your hand, and we'll call on you as they come through. If you're attending in person, again, you can just raise your hand in person and let the on-site coordinator know that you have a question, and they can you can speak up when we call on that center, or they can enter your comment or question into chat. I don't think we have anyone on the phone, but if we do, the way to raise your hand is by pressing *9. And we'll see that your hand is raised. We are also allowing you to share your comment using chat. So you can just click on the chat icon and then just enter any comments into the chat, and then we'll review that and we'll read that out loud on your. And then there's also the opportunity, we know that not everybody necessarily wants to share their comment publicly here. So you can email any comments to Patty at patriciarussell@lakecountyca.gov, or you can call Scott by the end of the day today. For folks who are in person, we also have a feedback form with a section for comments that if you'd rather write that in, that's anonymous, and we'll get those for folks who are participating virtually. Or if you're in person, you can also fill out a link. We also have that same survey available online that we'll share at the end of the meeting. So if there are additional comments that come out after this meeting, or you don't feel comfortable right now, you can enter your comments in there. So bunch of ways to contribute. We really just kind of want to hear all of your input and perspectives. So on that note, just because we are doing this hybrid model, we wanted to kind of try out going around to the peer support centers first and seeing if anybody in any of those areas have comments or questions, and then we'll kind of open it up from there. So I can just go ahead and maybe start. Is there anybody, and again, no pressure if you don't have anything right now, or if you want to share in a different way, but I can go ahead and start with the harbor. Is there anybody there who has any public comment or discussion that you'd like to share?
I have a question. We have Janet Taylor. Can you hear her?
I'm very interested in how many mini grants were given out last year, because I did get one and completed it. And I understand you didn't have that many applicants, which is understandable because of the epidemic. So could somebody answer me how many mini grants were given out?
This past year or currently?
Last year, I'm curious about last year, because I think the epidemic really did affect how many people applied.
Okay. I'm not sure offhand how many were given. I'd have to look into that and get back to you, Janet.
Any other questions?
Yeah.
Speak.
So I have a question. I have I'm Cynthia Barnes, and I'm with the Nest, and I'm the child development specialist. And I just have a comment. I'm really excited to see the development of the van, the mobile unit. That was something that has been in the works for a long time. And I'm really excited and happy to see that that's finally becoming a reality for Lake County. Thank you. Can you reiterate that? Did you hear me?
No, I didn't hear it.
So she's just saying she's excited to hear about the mobile street outreach program, and that's really excited to see where that goes, and she's just looking forward to it and thinks it's a great idea.
Great. Yeah, I'm real excited about that. Just to comment on that, we've heard so much, at least through the years, of how would you need to do more and more outreach. That we have our clinics, we have our peer support centers, but we need to go that extra mile of really going out into the community, doing that outreach. And so this provides a real opportunity to do that. So I'm really excited about how that's going to shape up.
If I may, I apologize, I didn't want to overstep there. I just wanted to, I'm looking at the actual annual update document, and I am seeing some numbers on the mini grants. And it says numbers served was 231. I believe that's the people that participated in the programs provided by the mini grants, though.
Well, looks like just interrupted there, Julie. Looks like Kendra Boyce, who coordinates our mini grants, listed that there was 9 mini grants were given in the 2021 fiscal year. Thank you, Kendra.
Carrie, I saw your hand go up and then come down. Were you going to just mention?
Yeah, I was just going to mention what Kendra had put in the chat.
Okay. Anybody else from the harbor before we move on to the next peer support center?
I think that's the end of it. Thank you.
Yeah. Okay, then we can go to the Middletown Family Support Center. Is there anybody there who has anything that they would like to share?
There's no one here that wants to share or has
Okay.
any questions. Thank you.
Okay, if there are, just raise your hand or enter it into the chat.
Okay, thanks.
Anybody from Lavos?
At the moment, we don't have anything. Thank you.
Thank you.
Great. And then what about Big Oak? Anybody, Big Oak have any questions or anything to share?
Not at this time. We don't have anybody here asking anything. If there are, though, I'll let them know.
Great. All right, well then I will open it up to the rest of the participants if anybody has any comment they would like to share.
Okay, I have some input. One of the things I noticed in going over the annual report and in the presentation here is that there's been less of a focus on workforce and employment training. And I noticed that a significant part of that is training for Lake County Behavioral Health Services, which is awesome. I would love to see some collaborations with our CSU system and the various training programs in mental health services, and potentially provide a connection for students graduating with, say, a master's in mental health or even a bachelor's in social work or psychology or some of the mental health fields, in doing some recruiting there. And even if it's just a matter of offering hours for interns and supervision for them in order to get those people thinking this direction, I think could really be a boon for increasing our workforce here. I love the peer support specialist certification that's coming along, and the community health worker programs are doing an amazing job of getting started. But I definitely would love to see more people who are already geared for professional mental health services to be kind of recruited and brought in to see what we have to offer here. I know a lot of the word out there isn't great about, drawing people into Lake County, but I could definitely see a need for it there, and a focus on increasing that program. Those programs would be great, I think.
Yeah, that is a good idea. We do a little bit of that kind of indirectly with our the federal loan repayment program that we have, that we qualify for as a mental health provider shortage area. And so the federal government enables it if people will come, from their graduate programs and work here for 2 years, they'll get $50,000 in loan repayment for their student loans. And so that's been, fairly successful, up to the point that generally after a couple of years, people leave. You know, they do their time, so to speak, and then they go off to frankly a better paying job. You know, and you know, in a different area. You know, that's one of the reasons, you know, from that experience that we really want to try and grow our own. You know, when people have roots in the community, family, lived here, grew up here, they're more likely to stay in that community. And so I think, you know, one of the really key things that we want to do is be able to nurture people that are from our community. I mentioned previously that, you know, we're going to have, you know, real collaborative with the Superior County region in having a wet program. OSHPED is contributing to that. So, you know, we'll get $2 for every $1 that we contribute to that, which is great. I mean, that's just awesome. And it pays for scholarships and loan repayment and stipends. And our share isn't a tremendous amount, but you know, it's significant. It will help. But we have, yeah, and now what that is, just really briefly, is that we contribute around $55,000, and then we'll from that we'll get about, you know, $160,000 worth of scholarships, loan repayment, and stipends. So that's a good amount. As I mentioned, it's not a tremendous amount, but it's a good amount. We also have other wet dollars that we want to use to really build and create and recruit people from our community to get into the system. You know, that's where we want to really, you know, work with our local colleges to be able to, you know, get them interested, be able to work with even our high schools and places where we can recruit people that are just, you know, starting off and trying to decide what they want to do. We want to be able to show them that this is a, you know, a good field to be in and a good place to feel good about the services that you provide. And so we'll be using our wet money primarily for those endeavors to get people into maybe it's just an AA degree, you know, or maybe it's just a peer certification, or you know, something like this, just to get people going and started and into the field, so that, you know, they'll be able to take advantage of those loan repayments and scholarships and stipends that the regional effort is doing. But just to get people started in that, I think is really, really important.
Thanks, Scott. And just want to quickly, from Bonnie, we had seconding that CSU Connection would be great. And then Ronnie, I see your hand up if you'd like to share.
I think Scott covered a lot of what I was going to chime in on as well. We have quite a few actually MSW interns right now that have started as case managers, and now they're working their way up through the BS. They graduated from BSW and now are doing their MSWs with Humboldt State and Chico State. So we have a pretty good partnership where we're really trying to grow people throughout the agency and encourage that continuing education. So any more partnerships that anybody can think of, we are happy to hear about, that's for sure. That's
I definitely agree that we could do more as well with promoting definitely with our high school students as well. And as you know, I'm working on that as well myself, to promote an interest in mental health fields amongst our students at all levels, really. I start with my fourth graders talking about it. And I think it's great that we're not just teaching them those skills to be healthy mentally, but also, and behaviorally, but also letting them know this is something that you can, you know, make a living at. This is something you could do for your work and a career. So I definitely think that moving that direction is really important. And that's another reason to have connections with the CSU systems, because it also means that we can then connect with them for a master's program, for getting licensed and those additional things as well, not just recruiting out of those programs, but even supporting our people going through those programs. So love it, guys. Thank you.
Another thing that we're doing that's indirectly related to this, but what you talked about, Julie, reminded me of it, is we're doing our mental health first aid. And you heard me mention probably previously, or you've heard it other places maybe, that we're going to be doing mental health first aid for every 10th grader in Lake County. We were going to be really hitting that last year, but of course, then the pandemic hit. But that's still what we'll be doing. Kendra, who talked about the mini grants there just recently, will be a big part of that, along with Michael Moss, in being able to go out to all the schools and providing that to every 10th grader. And so, maybe something will come of that, as people realize that that's an interesting field, it's a worthwhile field, and they have a real interest in it. So we'll see what kind of comes from that.
Yeah, I'll comment on that real quick too, Scott, is because we'll be actually we're working on it currently. So we're lining that back all up with teen mental health first aid in 3 different high schools as of this point right now. Our goal obviously is to do all high schools, but currently we're doing working with Middletown High School, Clear Lake High School, and Kelseyville High School to start this fall. And we'll actually be starting with seniors this fall. Our goal is to have 10th, 11th, and 12th graders all at the same time in a same school year, all be trained in mental health first aid. So that's our goal right now. So it looks like we're moving forward with that. Thankfully, now that the pandemic has kind of gone into a little bit of recess, and schools will be back in session. So yeah, we're ramping up for that. And our mission is, like I said, to do all high schools. So yeah, thank you.
That's great. Thanks, Michael. I mean, I just think the world of that project. It's one of the things that I think can be really transformative to a community. I really believe that. We're hitting that many people are getting that information. That will carry on for years and years of having that knowledge. And that's the kind of thing that can really transform a community.
Absolutely. And that Kendra and I both definitely promote mental health as far as from a career perspective, and talk to people about that if they're interested in that type of career. And we can tell the people that really want to help people and that are just naturally gifted at helping people and encouraging good mental health. So we definitely we kind of pull them aside and really talk to them as well, so we can kind of mold them or shape them into that positions as well. So yeah, there's some great young minds out there. So we definitely want to encourage them any way we can. And also, just to quickly mention, also we're going to have probation officers trained in mental health first aid, as we've been talking about. And that'll be encouraging, because that will might be off the subject a little bit here, but having probation officers on the campus with us also doing and helping with teen mental health first aid, just to kind of reduce that stigma as well, with the probation officer and the badge and the gun. And these people are people that they can be approached, and we want to get that out there to high school students. So there isn't that standoffish relationship, but build a better relationship with them as trusted adults in the community. So we're looking forward to that too.
Thank you. Yeah.
Thank you, Michael. Carrie, I see that your hand is raised. Do you want to share?
Yeah, I just wanted to mention, we did complete one teen mental health first aid program, and we had a student that actually as their senior project, started a support group for her peers. And, you know, partly because she went through that program, and, you know, we really encourage that. Because, you know, who knows, maybe that's the path that she'll take later in life. So it is hugely impactful.
Thanks, Gary.
It's wonderful to hear. Anybody else have any comments or thoughts that they would want to share? Questions, comments on the plan? Thanks, Betsy. I'm going to read your comment out loud, if that's okay. So from Betsy Kahn, older adult programs are still not sufficiently engaged in working with the needs of senior centers where volunteers were significantly disabled by the COVID pandemic, leaving unfilled gaps for providing assistance to homebound, mobility impaired older adults and their caregivers, many of whom need special assistance to prepare for anticipated power shutdowns and mandatory evacuations due to wildfires and other emergencies. A committee of the Area Agency on Aging's Advisory Council was formed, Seniors Thriving, to address the services that participants in now limited nutrition programs are further separated from, in addition to their social isolation. It appears that the need is not well understood, and the coordination with other Lake County agencies is definitely missing. Thank you, Betsy, for that comment.
I actually have a thought. It just occurred to me because of one conversation leading into the other here. That was good timing, Betsy. What about the possibility of doing the mental health first aid training for in-home support caregivers? Maybe with a stipend or a gift card or something for the providers that were to participate in that training. I think it would be great for people who do IHSS to have more, because right now I know they have minimal, if any, mental health training. It seems to me a really great place to do some base level mental health skills. Just a thought.
You know, I think that's an excellent idea. You know, we're really trying to expand mental health first aid training. You know, they have it for you know, different populations, for adults, for youth, for safety officers. You know, there's this different ones that can be done. Michael and Kendra are, you know, getting the certification to be able to do as many as possible. And we want to offer as many as possible. When we get the additional outreach staff, we plan on having them being able to be trained to do it as well. And we want to do you know, expansion into other agencies to be able to provide this. We're already, you know, looking at doing the 2 shelters and transitional housing places that we have in the community. We'll also be, you know, I think IHSS, well, that's a great idea. So I think we should, you know, put some efforts into that as well. We're also, you know, want to do more law enforcement. That's a big goal that I have, to be able to do that. And not just because of the recent news either, but just because it's a need that we've recognized for years and years. And it's just finding, you know, our poor law enforcement officers, they're very, very working in very thin staff, and so they don't particularly have a lot of time to do training. And the nice thing about mental health first aid training, it's a brief training. It's an intense training, but it's brief. And so, you know, I think with that we can really train a lot of our law enforcement as well.
We have another second from Bonnie that Julie's idea about IHHS workers getting mental health first aid training is brilliant. Any other comments from folks? Anyone from any of the peer support centers have anything else that you would like to add or any questions? From Kendra, we have Michael and I offer mental health first aid trainings to all in the community. Please contact Michael at is it Mose? Michael Mose?
Most.
Moss at lakecountyca.gov or kendra.boyce at lakecountyca.gov for more information. Well, if there's nothing else, any last comments or questions, thoughts that people want to pop into the chat?
I'd like to say a quick thank you to our board members who've made the effort to be here for this meeting today. We have Sheila here. I saw Camille on here. I know I saw, of course, our recording secretary, Betsy Kahn, Bonnie Blumenthal, who is our most recent approved applicant for our board. I know I'm missing somebody. But I just wanted to say thank you to any and all of the board members who've joined us here today. Greatly appreciate your support and being here.
Yeah, I'll say the same thing. It's really nice having the board here and doing this. I don't have to do any explaining to the state that we didn't have the opportunity, So it's a great relief to know that you're here and we have your support.
Absolutely. Okay, so then, and again, if you do have any public comments, let me go back just to Scott's phone number. So, if you have anything else that you want to share that you didn't share today, you can email Patty at patricia.russell@lakecountyca.gov. You can call Scott at 707-274-9101 at the extension of 26124. And share any other comment. And then at the end, we'll also share the link to this feedback form. Again, for folks that are in person, it's also available in paper that you can share any written comments or feedback about this meeting.
And just Patty's emails there. She's our MHSA analyst and she just is gathering everything and she'll make sure that I receive that.
So again, our next step, so this is the public hearing. After this, we'll be compiling everybody's comments, integrating those into the report, finalizing the annual update, and then a little bit later in August, it will be presented to the Board of Supervisors for approval and adoption. So this is the meeting follow-up survey. So here is the link. Again, there is a QR code. If it's easier for you to take a picture with your cell phone, with your smartphone, that will take you to the link. I just chatted the link in the box. And again, this is available via paper at any of the in-person sites. So this is two purposes. We'd love to get your feedback on this meeting, how it went, especially because this is our first time doing the hybrid model. We'd love to hear what worked and what didn't. But then there's also space for you to leave any other additional comment. And this is anonymous. So there's that opportunity, and just leave this up. But yes, we just thank you for your participation and for your partnership throughout this entire process and for trying so many new things with us this year. We really appreciate the input and collaboration.
I just want to say again, I really appreciate you're taking the time out of your morning, of your day, and being here. Your input and feedback are so important for this process. The MHSA is all based on community grassroots, and so having this and the community recognize what our needs are, what works. We really need that. So you being here and fulfilling that is just greatly appreciated. Thank you so much.
And thank you, Sheila. She says, thank you, DHS, MHSA team, and RDA for all the great work put into the development of this plan. Thank you. Ditto. Thanks, Julie. All right. And this is just some additional contact information if there's anything that you would like to reach out to us about. Betsy, go ahead. Did you have anything that you wanted to add?
Yes, thank you. I just was curious, what will happen next? What is the next process step that you're going to take?
Can you go back to that slide, Jamie?
Yeah, so the next steps that we'll take for this annual update is to incorporate all of the public comment that we've heard today, and any other public comment that we receive throughout the course of the day. If folks want to submit feedback or comment through email or call Scott. So then we'll incorporate all of that and finalize the annual update. And then that will be presented to the Board of Supervisors a little bit later in August, still determining the date. And that'll conclude this annual update process. And we'll probably start planning for the next annual update a little bit later this fall or winter, and then probably have kind of a similar timeline of early next year, having these community input meetings and starting the process all over again. Scott or Julie, is there anything that you want to add?
It is a continuous process. And I appreciate your patience with it. You know, I mean, sometimes I wonder, okay, we just got done and now we got to do next year. Wait a minute, we always got done. You know, sometimes you get that feeling. And so I appreciate your patience with us and continuing to go with us.
I look forward to being more involved from earlier in the process this time, as it was certainly kind of late in the process for us to become involved, but I'm hoping we'll be able to start with you guys from the beginning of all of it and be there along for the ride this time rather than kind of tagging on the tail end. So thank you very much for allowing us to be included and allowing us to take our part in this process.
Putting your email there, Julie, you know, one thing that we'll do is, I think next time we do this, we'll make sure your email's on the presentation as well, because the mental health board is a great place for feedback to be received as well, because you represent the community also in guiding our department.
And in our plans for the next year too, we're hoping to have a lot more involvement from consumers and family members of consumers and providers of services the whole year, because we really want to encourage that participation in our monthly meetings, so that it's not just once a year that we get the opportunity to have input, but really to have a voice the whole year round, and know that we want to hear what people are saying and what they have to say about services and what they have to say about their needs as well. Make sure that we're addressing those as best we can.
Okay, great.
So, spread the word and let's keep going.
And just so the slides are already posted online in both English and Spanish, but we've been recording the meeting, so we'll also post the recording of this meeting online as well for folks that want that available. Thank you, everyone. I think that concludes. Yeah.
You're free to go. But thank you.
Thank you.
Everybody.